Hi everyone, my name is Shrishti Sharma. I am a board certified preventive medicine physician, and since January is the Cervical Cancer Awareness Month, I thought I should talk about cervical cancer and its prevention. The cervix is the lower portion of the uterus that essentially connects the uterus to the vagina. Cervical cancer is caused by human papillomavirus or HPV, which is a virus that is transmitted from one person to another and can cause cancer in people who are susceptible. Any condition that increases your chances of exposure to this virus can increase your risk of cervical cancer. Though tobacco and sometimes oral contraceptive pills have been implicated as a risk factor for cervical cancer, the most significant risk of cervical cancer is sexual behaviors. If your first intercourse is at an early age, if you have multiple partners, if your partner has multiple partners, if you do not have access to screening services, or if the results from your screening services are abnormal. And lastly, if you have a history of multiple, or even if you have a history of some kind of sexually transmitted infections. All of these are risk factors that can put you at a higher risk for cervical cancer. The human papillomavirus or HPV is everywhere. You could get an infection and it could be transient. That is, you could get an infection and it could clear on its own. But if the infection doesn't clear on its own, then it can cause changes in the cells of the cervix, which can then go on to cause cervical cancer. The good news is there are some things that you can do to help yourself. First, you could prevent cervical cancer altogether by vaccinating yourself against human papillomavirus or HPV. Second, you could go in for regular screenings if they are available to you to catch the disease really early if it were to happen at all. The Advisory Committee on Immunization Practices or ACIP recommends that for children under the age of 15 years old, a 2-dose vaccine should be given to prevent cervical cancer. The doses can be given anywhere between 9 to 15 years and they should be separated by a 6 to 12 month gap. Now, if you are a teenager or a young adult, that is, if you are between 15 to 26 years of age and you haven't received your HPV vaccine yet, then it is recommended that you get a 3-dose schedule of the vaccine. The 3-dose schedule is also beneficial for people who are immunocompromised. The 3 doses are given as dose 1, dose 2, which is given about a month later, and dose 3, which is given about 6 months later. HPV vaccines are not for you if you are pregnant or you think you could be pregnant. If you want to receive the vaccine, you should talk to your doctor about the right time to start the vaccine schedule after your pregnancy is ended. There are 3 ways to test for cervical cancer. The first one is Pap test, in which samples from your cervix are sent over to the laboratory where they look for abnormal looking cervical cells. The other one is HPV testing, in which similar samples from your cervix are sent to the laboratory, but here instead of looking for abnormal cervical cells, they look for the virus itself. The third way is co-testing, in which they look for both the abnormal cervical cells as well as the virus. The US Preventive Services Task Force or USPSTF makes recommendations for different groups of women based on their age. But hang in there. The USPSTF is currently in the process of revising the last recommendations that it had made way back. So what do the proposed recommendations look like? If you are between 21 and 29 years old, it is recommended that you get a Pap smear done every 3 years. If you are between 30 and 65 years of age, it is recommended that you get a HPV screening every 5 years. Alternatively, if you are between 30 and 65 years of age, you could continue getting the Pap test done every 3 years, or you could get co-testing done every 5 years. The good news is that USPSTF recommends that now you don't even need to go to a doctor's office to get a sample of that cervical tissue. You can do a swab at home and send in the samples to the laboratory, and the samples are just as valid as what you would get in your doctor's office. The USPSTF does not recommend screening women under 21 years of age for cervical cancer. And for those who are above 65 years age, it is a person by person recommendation. If one thinks that you are at a higher risk for cervical cancer, then you could continue getting screened. Otherwise, there is no need for screening after 65 years of age if your risk is normal. And of course, if you don't have a uterus, that is, if you were not born with it or you had it surgically removed, then you don't need screening for cervical cancer at all. There's so much more to know about cervical cancer, but for now, you should know that this is a preventable cancer and you can get a vaccine against it, and screening really decreases your chances of cervical cancer. And that's all for today.